So thank you.
Hello.
Bismillahirrahmanirrahim. I welcome you all to this very important meeting of FP2030 Working Group. And to formally start the proceeding, may I invite Taimur Rashid for the recitation from the Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم القارية ما القارية وما أدراك ما القارية يوم يكون الناس كالفراش المبثوث وتكون الجبال كالإهن المنفوش فأما من ثقلت موازينه فهو في عيشة راضية وأما من خفت موازينه فأمه حاوية وما أدراك ما هي نار حامية صدق الله العظيم.
Jazakallah khair. To formally start the proceeding, I may request Dr. Talib Lashari. Okay. So we proceed with the introduction of the participants. So I first start with on my left.
Good evening, everybody. Renuka Swami, UNFPA.
Yes, Assalamu alaikum, everyone. I'm Dr. Fawzia Asad, Country Director for Chapago.
Assalamu alaikum, everybody. I'm Shaz Wazir Ali, currently the president of Zabist, but I've been connected with the primary healthcare programs and family planning for a long time.
Assalamu alaikum, Dr. Talib Lashari, Technical CIP, FP2030, local person.
Assalamu alaikum. My name is Zulfikar Ali Shah, Secretary Health Sindh.
I'm a program officer in family planning at the Bill and Melinda Gates Foundation based in Seattle.
Senior Country Advisor on Family Planning and MNCH to the Bill and Melinda Gates Foundation.
Good afternoon, everyone. I'm Marley Moffat, Program Coordinator for the Family Planning Team at the Bill and Melinda Gates Foundation.
Assalamu alaikum, everyone. Nusra, Pro Vice Chancellor of Dow University of Health Sciences.
Assalamu alaikum ji, this is Dr. Ali serving as CEO at Green Star Social Marketing.
Good afternoon. Assalamu alaikum. Nahid Memon, Director, Center of Excellence in Women and Child Health, Aga Khan University.
Assalamu alaikum, everyone. I am Dr. Masood Khan, Director, Health Services and Pharma at DKT, Pakistan.
Assalamu alaikum, everyone. I'm George Papakristo, Director for DKT.
This is Askari Hassan. I work at DKT and I oversee programs over there.
Assalamu alaikum. I'm Dr. Samina Afzal, working as Country Director of Willows International.
Assalamu alaikum. I'm Dr. Ali Ali. I'm Director of Post-Pregnancy Family Planning, National Committee for Maternal and Neonatal Health.
Fahad Shamim, working as Program Head for Green Star Social Marketing.
Assalamu alaikum. This is Dr. Abdul Qayyum, Regional Director, Ranma FP2030 Pakistan.
Assalamu alaikum. This is Roshan Tidar, Technical Advisor, Risk Consulting.
Assalamu alaikum. Good afternoon, everyone. I'm Dr. Moyuddin, Project Director for Family Planning at Risk Consulting.
Assalamu alaikum, everyone. Sheena Hadi, Executive Director of Ahang.
Assalamu alaikum. This is Dr. Razia Sadaf from RSPN.
Assalamu alaikum ji. I'm Khurram Shahzad, Program Manager Operations, Rural Support Programs for Islamabad.
Yes, Assalamu alaikum. Good afternoon, Dr. Tanveer Ahmed, CEO Hands.
Assalamu alaikum and good afternoon. This is Kamar Sheikh, working as a head of health department. Good afternoon. This is Kamar Sheikh, working as a head of health department.
Assalamu alaikum ji. Dr. Arshad Chandia from Jipaigo, Islamabad.
Assalamu alaikum, everyone. Dr. Saib Jan Badr, working as a program coordinator for Accelerated Action Plans in.
Assalamu alaikum ji. I'm Shabir Rahman from, I work with the director. Thank you.
Assalamu alaikum. I'm Dr. Rabia Ahmed, working as Deputy Director MNCH, PPHI.
Irfan Hussain, CIP.
Assalamu alaikum, everyone. Muzaffar from CIP.
Abdul Sabur, Risk Consulting.
Assalamu alaikum. Usman Sheikh, working as Communication Officer at CIP.
Assalamu alaikum. Irfan Azhar, Risk Consulting, IT.
Assalamu alaikum. Good afternoon. This is Dr. Ishfaq Memon, serving as Senior Program Manager, Pathfinder. Thank you.
Assalamu alaikum. Dr. Walid Ayamu, Senior Program Manager, JSI.
Assalamu alaikum. Dr. Ahmed, Director Programs, JSI, Sindh.
Assalamu alaikum. Taimur Rashid, working in Paigo, Islamabad.
Assalamu alaikum. I'm Ijaz Ahmed from UNFPA Sindh.
Assalamu alaikum. This is Aisha Lagari from PSI.
Assalamu alaikum. This is Dr. Zaib, PPHI Sindh.
Thank you, everyone, for the introduction. And it's a great pleasure to see all the family members together of FP2030 working group. Yes, any new participants that have joined, please introduce yourself.
Assalamu alaikum. I'm Dr. Samira Ali Rizvi, Department of Public Health, Zabis.
Assalamu alaikum, everybody. Welcome. I'm Sania Zahra, Family Planning Officer, Advocacy Officer, IGO.
Thank you. Thank you, everyone. We say that the world is to hear from Dr. Talib Lashari. So over to you. He'll be speaking on the journey of change in Sindh for the rest of the ceremony. Thank you. Over to Dr. Talib.
Thank you.
Thank you for a wonderful start of this event. I welcome Lene and Murli from Bill and Melinda Gates Foundation, headquarter, USA. And today's event is basically to meet both of them. The purpose was to gather all the FP 2030 partners so that we could have a discussion around what we are doing in Sindh province in terms of family planning 2020 and FP20. Basically, this meeting was kind of FP 2030 working group meeting, but due to our chair, Honorable Minister for Health and Population, Dr. Azra Fazal Pechu, who was very busy with the Sindh Assembly Standing Committee in the morning, and then she had to go to attend the Sindh Assembly session. So previously she confirmed, but later on she could not make it for this. So we have then, due to decorum, we have to little bit alter because we can't say it FP 2030 working group meeting because the chair has apologized for her because she's very particular about this in the assembly session. She was very particular when there was she was member of the National Assembly. She never misses even one meeting of the National Assembly. She's so committed. So she permitted us to, and also I think it has been time that we couldn't meet each other in the same setting. And with this, I think one objective is to meet and listen from our BMGF colleagues, and especially their experiences for the past few days in Pakistan. They have been to Islamabad, to Punjab, and in the last leg they are here. They started basically from Sindh, then in the last leg they are here. And thanks to Dr. Yasmin Kazi, who has been coordinating this entire trip of the delegation, and she is senior advisor for BMGF in Pakistan. So other objective is to with you the updates and there might be some repetition for planning and Sindh, so there might have supported this event. Riz Consulting, Dr. Muhyiddin is here, and Roshan Fida, and Dr. Fozia Asad, and Renuka and Bejaz here. So this is way is strong and going well in Sindh. And Lene Murli, especially on the initial of CIP and FP 2030. So we will hear some comments, and I'm glad that Zulfikar Ali Shah Saab, secretary of him, that he has been here with us, and it's also an opportunity for sitting delegates to meet him, although he met them yesterday as well during the ministers' meeting. But I'm grateful to Shah Saab for being here. And he has been very supportive in all the initiatives of family planning into the Department of Health. Department Health is very, very crucial in terms of family planning. And also he is very supportive in 1000 days program supported by the World Bank and Islamic Development Bank, which is coming in very soon. And also he is supporting a lot on Reproductive Health Rights Act, which is now amendment approved the amendments into the RH Act, including healthcare and marital and neonatal child mortality surveillance. Three aspects we have now added into the Reproductive Health Act, and today approved by the Standing Committee of Sindh Assembly this morning. So we will be, before I go to the presentation, it would be good to hear some comments from some of the partners. So I will invite Dr. Yasmin Sabi Qazi for her comments. Dr. Yasmin Sabi is a country advisor for BMGF, Bill and Melinda Gates Foundation in Pakistan.
Thank you, Dr. Taleb, and thanks a lot for giving me this opportunity. Secretary Saab, Zulfikar Saab, Dr. Taleb, Madam Shanaz Waziri, our champions and all our partners in the room. I think we have been together in this journey from quite so excited about the new perspective, the new lens that it brought to the development sector. And we heard first time about the rights and about young people, about making connections to the other development priorities. And it was very exciting. Pakistan has always been in the lead of this kind of global commitments. But we also saw that with the MDG, the priority on family planning went on the silos because of MNCH and other things. And I think FP 2020 movement, the way the FP summit happened in 2012, I'm very lucky I was there in London to attend that and saw that how Bill and Melinda Gates Foundation, along with the UK government, tried to bring back everybody's attention on family planning because it was, and it is still is, an unfinished agenda. And if people thought, oh, we have done enough because of the ICPD, because of the follow-up, and we can move forward for other things, it is not true. And as you all know, in Pakistan and many parts of the world, the women do not have access to contraceptives, the women and girls. And even if they have an access, the services are of not high quality. So one of the major issues that we face in Pakistan is the discontinuation. So women have the need because unmet need hasn't gone down. In our, it has really, I mean, those who do research who are sitting here, they just move a little bit, which means that there are couples who do not want any more children, but we are not able to reach them. So it's a collective failure for all of us. And we should own it. Do that effectively as one community. Well, everybody, I mean, these are so many logos here, and of course, BMGF logo is there as well. Everybody has a niche, everybody has a expertise, but we should all work as a community to really look at the larger landscape, where the gaps are, why we have not been able to reach those couples who have this unmet need, because these are the low-hanging fruit. Creating new demand and bringing those who are opposing family planning is a much harder task. But those who have the unmet need for family planning, why we are not able to do that? So it's a challenge which I'm giving to Health Secretary Saab, who's here. Very happy that health is taking the lead in it, to all of us. So if we even start strategizing to reach to couples with the unmet need, we can, I mean, we have 34% CPR as per last PDHS. I'm talking of the national one. And if we do the 18% unmet need, we're already above 50%. That's, that's what the goal is. So it may sound very easy. We know that. So it has to be looked from both supply and demand side. The supply side, initially, program was very much supply driven. So just get things on the ground and it will happen. It didn't happen because IUCD was inserted, I'm talking about 60s, sometime without consent, sometime without proper counseling, sometime without proper infection prevention. It backfired. So I think supply is very important, and supply going to the last mile. And it's not only the supply, then the demand creation and the behavior change. And that is all go to the last mile. All of our behavior change is very much urban, is very much addressing certain populations. So how do we even the communication strategy. How do we reach out to those who really need to listen to us? So I think these are the kind of things that we all are. I know everybody is so concerned, so committed. We should continue to do that. And by, thank you, Sheena. When I see you, I just remind myself, I have to talk about young people. Pakistan is a young country. It's one of the youngest country. The demographic dividend 65% below 35 years. And we are getting women in our facilities after they have had 3-4 children, after there has been a lot of, so young people sensitization should start before they are married. Pre-marriage counseling, very welcome move by the government. Sindh is always far ahead in everything, so we are hoping we'll have some good evidence to see how do we reach out to couples before they are married. But then should not be just behavior change and counseling. It should be about supply. Private sector. So I think private sector is a huge opportunity, which is largely untapped for family planning. So we have these dynamic social marketing groups, Green Star, Dickety, we have Medistos, we have FPP, we have PSI, we have these amazing hands. But what about the private sector? For equity remains a concern. It should be a concern because the poorest of the poor do fall out from the landscape, and we need to really make sure that we are reaching out to them. And then uh, I will not say much because my colleagues are sitting here and they're the data geeks. But are we measuring our impact? Do we know where we are going? Do we, are we reading what is happening? What needs to be done? What's the course correction? What will be the immediate few things that needs to be done? So health system is strength overall. FP2030 framework, SIN has to be created for HR bill. FP2030 framework, you are leading the way, Dr. Talib, the health minister department, the population department. But we need to continuously keep on checking ourselves, accountability for all of us. Are we really trying? My God, we haven't done anything. Where is the CPR? Unmet need is. We do not need shocks. We need some periodic surveys, Dr. Talib and Secretary Saab. We need annual surveys. We need to measure our progress at a much better intervals. So we are able to do course correction or maybe have new solutions in a timely manner. So this is one of the things I would really like to put there. We should not forget the 8 recommendation by the CCI. And of course, we should not forget to align with other sectors. So health has to take the lead. It is a denominator population, so please take the lead. Unless health does not start delivering family planning, things will not change. So very happy PPHI who's doing safe, and it's an example that family planning can be done very effectively at the health sector. PPFP, whoever is doing it, they have done some great job. But not only health, we have to align with immunization program, we have to align with nutrition, with childcare, we have to align with MNCH. So, we have to find our partners because family planning on its own, standalone, cannot tread the way that they should. And the women should remain at the center of everything that we do. What woman wants, what are they looking for? The woman and girls should remain the center of our peace. And my colleague Pakistan, so I will not say much. I just want to say thanks to Sindh Ministry, Dr. Talib, for his leadership on family planning, and to all the partners who are in the room. And let's start working as one community. Thank you so much.
Thank you, Dr. Yasmin. And I like your last words that let's start as a one community, a single community. And I think that is the magic, and that is the way to move forward. Remaining within our organizational boundaries, we have to move as one team. So very good points on periodic surveys, which shows the importance of data, and on to the health sector, health department, which is very important. So with these good ideas by Dr. Yasmin, now move to Dr. Fozia Asad, who is conductor of the Japai Board.
Thank you very much, Dr. Talib. Bismillahirrahmanirrahim. Assalamu alaikum. Once again, first of all, I take this opportunity to congratulate CIP Sindh on two things, because CIP FP 2020 came as one of the best practices globally. So I think credit goes to Madam Minister and the leadership and complete team of CIP. And then secondly, I think that CIP Sindh was the first forum which developed guidelines for the continuation of family planning and reproductive healthcare services during the COVID pandemic. Across, Sindh was the only one in the world doing this job. So I think these were two important things which we must appreciate and acknowledge. Now, coming to our commitments made for FP 2030, that's boosting up the CPR of Sindh to 50%. It's quite an ambitious target, honestly, for us as a team of both the public and the private sector. And thank you for Dr. Yasmin for setting the context. This will all require our collective wisdom, our collective efforts, and strategic insights and multi-sectoral approach. Most of the time while sitting in such forums and meetings, we talk about multi-sectoral approaches, but honestly, reaching this much target, or at least near to this target, we will really require some strategic thinking and some marathon really to engage all the required actors into this multi-sectoral engagement process, whether academia, whether educationist or economist or media or journalist. So there are many stakeholders which can contribute together for developing an integrated approach. Honestly, this is the time for not only integrate the subject of family planning into the Department of Health, of their expansion of facilities as compared to population welfare department. Definitely both the departments are now the custodian of family planning services, but we have to think out of box, something new which can engage more and more people in both the public and the private sector. And very true, we have to come up with some very smart public-private partnership model to facilitate the private sector too in making all this possible with the contribution. One thing which we missed for past many years is engaging male into this whole family planning business, and we left them behind for years, honestly, if you ask me as a public health person. So this is the time, and we have seen a momentum now. Willows is doing a wonderful piece of work for male engagement and vasectomy. So definitely these sort of, and much more needs to be done for ensuring the male engagement at the community and the facility level, how we can ensure that will bring more empowerment, not only to the community, but specifically to the woman herself. It's really heartening to see the announcement just made by Dr. Talib about the inclusion of the self-care and self-care, gender inclusion and women empowerment, self-care. We have to include innovative approaches in the process, how we can address the needs of our urban slums. Because in the last PDHS, we have seen a decline of FP services in the urban population. So and we already there, evidence is there. We just need to scale that up. Then about the expansion of FP choices, all of us are learning more and more with every passing day about DMPSC. And Sindh is leading for many years in starting this process, but how it can be scaled up properly, structured way, not only in the public sector, but also in the private sector. We need to think collectively around it. So these are some of the things, and in to far-reaching results to reach our ultimate goal of 50%.
Especially you have mentioned the role of public-private partnerships in family planning. And we know that in Sindh, there has been good practices on PPPs. So we need to strengthen these further. And also, it will be good to have integrated approach and innovative on all these and to move forward on FP 2030 roadmap so that we continue to refine our strategies and interventions. This is the main purpose of our meetings. So let's now hear from Uga Swami, UNFPA representative in Sindh, Renuka.
Thank you so much, Dr. Talib. And I'm just wondering, with all the comprehensive key points that our colleagues have put forth, what's more left for me to add? But thank you so very much. And on behalf of UNFPA, a very good evening again to all respected colleagues, FP champions here on the podium and across the room. Taking the opportunity that we're also commemorating the World Population Day today, I'm so immensely pleased to start off with this good news of the Act being passed, much awaited. So congratulations to a government of Sindh, to all of us, and Dr. Talib, your leadership. With 2022 also marking that the world's population would be reaching 8 billion, I think it, ever than before, it underscores the need to reinforce our conversations and channelize our conversations from numbers to rights, to informed choices, to responsibilities, and for taking forward the agenda of balance. In the country, we have the national narrative on family planning, at the province as well. And while we do advocate for rights of couples, rights of young people, or as a matter of fact, when we're talking about rights of women, I think rights with making informed choices about the family space, about birth spacing, about family planning, as well as it comes with responsibilities. And the same couples are responsible to their family, to the children, to the community by and large, and to the state as well. So both the rights and responsibilities, championing for 4 million young people are entering the world, and around 7.6, excuse me if I'm wrong with the figure. And so the huge number of unemployed, or rather I would put it, who are not productively engaged young people, how their non-engagement in productive discourses and developmental agenda kind of feeds into the whole cycle of whether it's poverty, adding on to the plans by to support government of Sindh, family planning 2030, youth empowerment. And more about our work as we all discuss, we'll share about ongoing support. Thank you so very much.
Thank you, Renika, and always we appreciate this PA to the government of both departments of health and population. They are providing annual support, and that is whatever the amount is, but I think it's a huge technical support from the unit in terms of narrative, national narrative, these RH Rights Act, and two were the bills which were presented before the standing committee. And I'm told that all three approved by the standing one bill which was designed by the Zabist under the leadership of Madam Shahnaz Wazir, who is president of this, and very to spare some time to be here with us. So under her leadership, one bill was on the protection of healthcare workers, protection of healthcare workers, and this bill has also been cleared from the standing. Bill was on the Dow University's regarding the Dow University's amendments to that. Shah is here, and the RH Act was already will now go to the assembly maybe very soon. So the passage of the bill is pending. Now we will hear Dr. Muhyiddin, who is PD of the RIS Consulting, for his intro remarks.
Thank you very much, sir, and good afternoon, everyone, again. I feel privileged to be here today and would like to acknowledge the Government of Sindh's commitment and contributions towards family planning. Sindh government's towards FP20 and FP2030 are commendable, translating policies with CIP formulation in 2014 and 15, and it was a major step in this journey. Sindh took lead on introducing Sienna Press, in which users. One of the most and innovative ways is also conducting policy landscape analysis of Sienna Press, which should provide evidence to introduce and scale the rollout of Sienna. Need of a national narrative on the introduction of Sienna Press using high impact practices, strategic framework on introducing new contraceptive technology, and the role of public-private partnership obviously cannot with development partners and collaboratively pave way for the SI scale-up, and we continue our support to the CIP and Government of Sindh. So thank you so much, sir.
Thank you, Dr. Muhyiddin. And we know that RIS has been supporting through BMGF support to Sindh government on training of DMPS Sienna Press, on training of DMPS Sienna Press, the DMPSC Sienna Press, and these trainings have been very unique in the way that we have introduced a completion process of the certification. Rather than just having participation certificate, we now, these trainees go through the experience, clinical experience, and then that is the second certificate, and then the third certificate is of completion. So now rest of the partners already recognize this importance of this, and they are also supporting us in trainings in terms of completion of all three stages. So this is very important, and this basically, you know, standardizes the trainings in terms of quality. So thank you, Riz, for this, and perhaps we do a presentation which is just to show Lene and Marley and rest of the team that what Sindh is doing, it has been doing for the past 5 years, so that you would have a glimpse of the work that is being done. But we will keep it very short, although I know there are Riyaz, you didn't stand. Okay, so he's working. So, and Musarat, I can't see Musarat here. Okay, Musarat should be here anyway. So, so this team has also contributed enormously in this presentation. Next, please. And also, let me share with you that this event is live on YouTube now. So there is a link, and anyone can watch this event live on YouTube, which is a channel, Sindh Population News. This is the channel of PWD Sindh, and this event is now telecast live. So there's a link, and if you can show on some slide, but I think most of you have received that WhatsApp, because this has been put on WhatsApp group. Did you put on the WhatsApp group? Okay. So this is just the indicators from PDHS. In terms of CPR, unmet need, total fertility rate, skilled birth attendance, institutional deliveries, antenatal care, postnatal care. There is improvement in terms of deliveries happening at the institutions, and skilled birth attendant deliveries, which are 74 or 75% in Sindh now, and 72% institutional deliveries. Antenatal care percentage is typo error. It's 85, wrongly 54%, but it's 85. Postnatal care is also high. Especially if you bifurcate in rural parts, it's improved. It has improved 4%. Brother Fazil and Madam Shahnaz Wazir AP formulation, and more than 100 meetings with all you sitting here to formulate the CIP. 6 strategic areas, and to formulate the CIP, we use this CIP toolkit, which was globally designed, and that was designed by the USAID. And that toolkit was used. And very recently, that toolkit has been evaluated by the USAID Momentum Project, and a report has been issued for that. So you can see in the pics, I mean, these are meetings which are taking place. And in this pic, the young leader, Asifa Bhutto Zardari, also at the meeting, in early 2019. So strategic area included functional integration of health and population, quality of services, supply chain management, reaching to the life, expanding services with supply and demand side interventions, knowledge, and meeting the demand, creating awareness. Lastly, the performance monitoring and accountability. These 6 strategic areas were part of the CIP, and we introduced so many reforms to Minister Task Force and FP 2020 Working Group, provide technical support for policy planning reforms in population sector, gather and conduct data analysis to track the progress on FP 2020, FP 2030 in the province. Next. So, for the accountability purpose, for the Sindh FP 2020 Working Group was established, and now it's called FP 2030 Working Group, which is chaired by the minister herself, and it's across several, like PND board is there, finance department is there, education and women development, information and youth affairs. These departments and all the development partners are part of the group. Next, please. So now I'll jot down through some of the reforms, and these pics are from the rural parts where we had sessions with the women. So the reforms under each strategic areas, which basically contributed towards increase in the CPR, included integrated services, functional integration between health and population. So now we have one minister for both population and facilities have been shifted to the Department of Health Facilities. FP 2030 working group, which is basically the platform where all partners sit together and on quarterly basis and take the decisions on previous implementation and next steps. Task shifting and task sharing has been another important area, especially the first dose of injection was introduced for HWs and the long-acting methods through family welfare workers, LHVs and CMWs. And that first dose of injection notification was issued on 17th of October 2017. Quality, under the second strategic area, we have a family planning manual on quality standards. And I am also pleased to share that this family planning manual on quality standards is now part of the Reproductive Health Rights Act of 2017. So 90. So the FP manual is now part of the law. So everyone has to ensure on the long-acting methods, PPFP, PAFP. Dr. Shabir is here. Post-abortion family planning policy is there, and through IPAS support, they have a pilot kind of project in Hyderabad and Jamshoro, post-abortion family planning, and that has been integrated into health and population both. So thanks to IPAS for that support. Counseling, Siana Praise, these trainings were conducted, and refocusing lady health workers on family planning. So this was our task, and at the start in 2015, we saw the workers, and you met some of the lady health 2 days, and now this percentage has rose to 33%. So now they are spending 33% of their time on family planning, because their basic goal is family planning and primary health care. They are supposed to spend 50% of time at least on family planning. Now they are spending 33%. We want to move that up to 50%. So we hope for that we'll do it soon. And client satisfaction, for the purpose of quality, we are conducting small scale surveys on periodic basis. Supply chain is very, and in this regard, the important thing is that Population Welfare Department has started procuring contraceptives at Sindh level, and these contraceptives are for all stakeholders in the public sector. And also we provide to selected NGOs and partners. Sindh is the pioneer in procurement after the 18th Amendment, and after the end of USAID support in contraceptives, because it ended in 2015. So Sindh immediately started procuring. And now I think Punjab is procuring, and KP is also bringing some of the contraceptives. Access to youth, poor and male. This is an area where we have been focusing. Life skill-based education, LSBE, is the hallmark of the CIP, and we had university seminars, youth clubs. So we are trying to mobilize youth, and this time it's again area number 3 in the FP2030 roadmap that we will be implementing this, implementing the LSBE. For the poorest of the poor and in the remotest areas, and reaching to vulnerable population, family health days were conducted through CIP, through Population Welfare Department. So I think that was another area where we were able to reach to many poorest of the poor. Male engagement, we have in the Population Welfare Department male mobilizers, social male mobilizers. At the same time, we introduced Sukhigar counselor, prosperous family counselor, for engaging the male through CIP. One thing, the wonderful thing that Willows International, Dr. Samina is here, country director of the Willows, they have started vasectomy trainings for the social male mobilizers. So thanks to Willows that they are providing a lot of support, and thanks to Ahang for LSB In fact, I forgot to remember to mention. So Willows is providing vasectomy trainings to male mobilizers and to urologists of some of the private hospitals and some of the other hospitals, and that is to introduce vasectomy in the province. Awareness and demand, engaging communities at larger level, engaging them through legislations, accountability for the results. This is the FP 2030 forum, which makes everyone accountable for results. Total 18 meetings have been held since 2016 onward. And next meeting is due very soon. We'll be having. Next. This is just snapshot of the trainings. Around 17,837 trainings have been conducted. One thing I would like to highlight that when we started CIP, there was a very low level of. We found that through various consultative meetings with the providers, they told us that there is no trainings have been held for the past several years. No refresher trainings, nothing. So that was the reason that we started focusing on trainings, and due to these trainings, lot of impact has been there. Difference, we could make the difference because previously there were very few trainings and people didn't have any refreshers. Next. There's a robust CIP data collection mechanism, and this is the pick of proforma that is sent to the already. It is with the Department of Health and Population and PPHI and some selected NGOs. So they collect the data on the CIP proforma and they send it to us by start of the month. Every month, best we have a mobile software, and through BMGF support, there was very important auto survey crowdsourcing sampling survey that was for 6-7 months, and it really did made a lot of difference. It was a good survey, and they next. This just tracking the progress, and I would like to request Riaz and Majid to just show these slides to us. And very, very briefly, so that
Assalamu alaikum. So this is our goal, 9,86,000 is our goal to achieve 45% of CPR in 2020. So till now, till 2020, we have achieved 7,70,000, and now we are on 16 lakh in June 2020. And this is a distribution of achievement. So in start, we have distributed all the goals between the PWD, DOH, and PPHI. So this is a progress, we can say, tracking progress. We are tracking progress of RSPN and other. And these indicators of core indicators of FP 2030, in which we can see referrals. Most of the referrals are referred by FW and LHWs, and like seeing the parity, 3 to 4 childs are taking more, coming more to our facilities. And then education, most of the clients are with no educations, means that we can say they are illiterate, and we can show occupations. So the laborers are.
Majid, this is just a shift from traditionally there used to be less educated or women with no education. They didn't have access to family planning services. But we especially started family health days in the remotest areas for uneducated women in the areas where education is less, or illiterate women or families are there. So you can see that now there is more uptake of FP by no education, women who has no education, and primary have also primary school going more uptake, as well as you can see occupation wise that laborer, their husband are laborers, and peasants, they a good percent. Children and 1 to 2 children, they are also having uptake of services. So next.
Additional users which we have required till 2025 and 2030, 3.2 million, and then yearly targets of the 2022 till the 2030, and 2.3 million new additional users. Next.
So this is basically, so we have, what we have done, we have quantified the unmet need into numbers.
From the April 2019 to till June 2022, total consumption 354,000 units has been consumed, and the share is the PWD share is 205,000, and the PPH had 97,000 users consumption, and the LHWs are 37,296, and the RENMA FPFP have consumed the 13,688 units of and these are the indicators which we have collected through the data and pro
Age and
forma,
parity. Age and parity wise. This is the impact of the reforms. I mean, as per PDHS, as per CIP database, as per Track 20. So these all the figures are well within the confidence interval of PDHS, as per CIP database, as per Track 20. So these all the figures are well within the confidence interval of PDHS. Next. This is the mobile application, and Yaqub, a man who has developed this mobile application, and at the CIP, it's very user friendly. These are CCI recommendations. Next. This is the roadmap, and as I mentioned, a very thorough consultative process was held, around 13 consultative meetings, and through participation in those meetings, we developed the roadmap for FP2030. Next. This is the vision. Basically, the vision is to transform social and gender norms by 2030, whereby women agency and the autonomy of decisions of the women will be respected. Next. These are the objectives, just to say that we will consolidate the reforms that we have already introduced during the previous 5 years. Integration, including public-private partnerships, engaging youth and adolescents. Integration, including public-private partnerships, engaging youth and adolescents. Quality. Next. Advocacy and social behavior change communication will be the hallmark of SBCC strategy. So all partners are requested to be part of this process and suggest us. And I think Pathfinder has organized a part of this process and suggest us. And I think Pathfinder has organized a SBCC conference few days back in Islamabad. So Pathfinder and other algos will be supporting this strategy. Enabling systems through legislation. We have talked about the legislation. Multi-sector approach will be talking to education, women development, and youth and climate change, and university. They will all be part of engaging the male and system strengthening accountability. Next. Through these all practices, recently a evaluation was conducted by the USAID Momentum Project of 43 CIPs in the world, and 3 best practices were identified. One is from Sindh, Pakistan, other is Tanzania, and third is Ghana. From Sindh, the best practice identified globally from Sindh, Pakistan, other is Tanzania, and third is Ghana. From Sindh, the best practice identified globally is bringing all stakeholders on one platform and subgroups to synergize the work. For Tanzania, it was shown that evidence-based strategies and priorities and partners were aligned with the priorities. For Ghana, it was told that CIP toolkit was very useful. It helped for the resource mobilization and for advocacy purpose. It is the same toolkit which we used to do the CIP. I can personally say that since I designed the CIP, so I can personally say that this toolkit is very useful globally. And we also discussed during some of the webinars with the FP20 Global that this toolkit is very user-friendly. There are some issues into the toolkit, but toolkit itself is very robust and very useful because it shows clearly that who is doing what and what is needed. So I think this is globally one of the best practices. This is just a report, which is you can see the pic, and it's available on the Mitchell Folsom the pic, and it's available on the Mitchell think that they are training information management system teams, whereby we if someone has got the training, they will not be able to appear in another training till 2 years of that training. So after 2 years, we will introduce again the refreshers. Next. And Japaigo supported for this to us. These are some of the publications. Next. This was a meeting for the FP2030 delegation from Washington, and you can see Kelly here. Kelly came, and now you are sitting on the same head table. Kelly came here, she was here, and they also had a meeting with the Chief Minister. And next, and they also went to facilities, Kelly and other colleagues. Next. Thank you. I think now we will move to our last leg of this program, and that is to your time. So what I suggest, I will invite all the heads of the organizations who are sitting here to say a few words, what they are contributing into the family planning. And I'll start from my left side, and we'll invite from AKU, Zahid Memon. So just 2 minutes for everyone. So I'm sorry for the time, because we would also like to hear from Lene.
Child Health and Immunization Services, the Department of Health facilities, primary, secondary level, as well as outreach LSW program. So what we are doing in this project, for example, women with child coming to an immunization center, she gets information about family planning and referred to the services. Similarly, at the pediatric OPD, same information is provided, and if they need services, they are referred services. And we have strengthened services in terms of the capacity building, sensitized the healthcare providers about gender-based violence, and now created a some space in community for adolescent girls, especially abuse, because this is one of the sustainable community space available where allow their girls to go and attend these sessions. So we are learning, as we are all aware, this is new group. We really don't know how to communicate. Number one, what language they understand. We have collected within the adolescent and found that 17 and to 19 is another group. Their priorities are different. You can't use same spaces for those. So this is a Sehatmand Khandan program being implemented doing a midline assessment to see its effectiveness. Once it is established, we will work with the CIP and the FP20 Secretariat to scale this to different districts. There's another program that Lene is very much aware that I'm involved, that is FP+. So just briefly, we are learning from other countries who have achieved excellent progress in family planning. And once we identify and do the deep dive studies and learn the lessons and share this across a variety of stakeholders. So thank you.
Thank you. Thank you. Especially it's promising, and I'm looking forward to Zahid and your work that we want to basically integrate family planning into the department. So this will be a point, not a starting point because already Department of Health is doing, but this will be one of the best practices that how we can inculcate family planning uptake into Department Health for the impact, for wider impact. So,
working close with state government, we're going to stay in three pillars. One is our network, which we're going to expand and to enhance and to make it strong. The second is partnerships with around the table. We are very close and developing partnership with Jibago, and we're happy to work with other organizations. And with the same government, the third pillar, which three of that pillars are organization, network, and partnerships. We are going, to be strong in same area to develop more.
Thank you. And DKT will be the major stakeholder to engage with the for-profit sector and through their network of the nurse. So we look forward. Dr. Samina, Country Director of Willows International.
Okay, so Willows International is working in Pakistan since 2008, but we started working with the Sindh government from 2000 in 2020. We met them first time in 2019, and then we started our two programs with the Sindh government, one with the Lady Health Worker program, in which we are training lady health workers on how to prioritize their visits to the women who have an unmet need by using Willow. Which we have is for 3 years, which started in January 2022 till December 2024, in which we are supposed to train 1863 lady health workers and their supervisors in 5 districts of Sindh, Shahid Be Nazirabad, Jamshoro, and Hyderabad, and 2 districts of Karachi. And our second program, we are working on the vasectomy, which was a new adventure or a new initiative for us to, and it seemed difficult, but the donor wanted us to work on this program. And so the first step which we took was that we went to the population welfare department, and after getting that MOU signed, we started working with them. So we trained their 208 male mobilizers who are working in Karachi. And they started the community meeting where we created the awareness on the benefits of the vasectomy procedure. Then on the second part of we started, I signed an MOU with the Pakistan Association of Urological Surgeons, who are the private doctors. And they are the one basically who will do the surgery. So far, we have trained 17 medical students, 15 medical graduates that have been trained how to perform this vasectomy procedure. Before our intervention or before our training in Karachi, the population welfare department did 9 vasectomies in 9 months. And after our program activities and with the help of those male mobilizers who are doing these community meetings, till date, in last 9 months, we did 112 vasectomies. So it was not as per the I would like to see, but still, if you compare 9 vasectomy, the 112 vasectomy, it's a big start, good start. And we are here for the next 3 years, inshallah, and we hope to see good results. And both the departments here, I would like to appreciate the efforts of the CIP, how they are collaborating with us and how they are continuously providing us the support, starting with the drafting of the MOU till the implementation of the activities in all these districts. I'm extremely grateful to Dr. Taleb, Minister, and the Population Welfare Department, and the Health Secretary too, and the Health Department, that even at a grassroots level, everywhere, we are getting very good support from the government and with the good results which we are seeing.
Thank you, Dr. Samina. And I can see and I personally know that you are so committed, and I personally know that your president, Dr. Turgis, is equally committed person. And sitting in Boston, she is, I think, her eye on your work very frequently. And she is very supportive. That's why this program is going on. And I think Willow's box system is very, very impressive for enhancing the work of LHWs. So for the NCMNH.
Thank you, Dr. Talib, and acting reverse. Believe in integrating services and also sustainability. So we work mostly in the government hospital and secondary and tertiary care hospitals, and training and equipping their SBAs and the hospital for providing these services. And we also establishes linkage with RHS, because RHS centers there in the government hospital and counseling and other. So it was a very successful venture, and it was both after abortion and after delivery. And this is low hanging fruit, and this is a very cost effective, and in less time you can achieve. First, we have FP 2020 goals. Now we have FP 2030, and we have a, as Fawzia said, we have a very high mark to achieve, and this is the effective way and easier. And there's a lot of women coming and they want those services. So this is the area we find can be sustainable. And we have a lot of support from the Sindh government, and we have a lot of meetings. I think they have a data of postpartum family, which was not shown here, Dr. Talib. It was a very impressive data of implants. Thank you.
Yes, I think NCMNH is doing a lot in PPFP support, and we have also integrated Siana Press, MPS SC, into the services that you are providing at tertiary care level. So since Dr. Aziz Abba has left, who is head of the Green Star social marketing, but Fawad Shamim Saab is here. Please say a few words. I'm sure you will talk about TCI as well.
Yes, sir. That is our pride. Thank you, Dr. Talib. Green Star is working in Pakistan for the last 3 decades and are the private sector. So we train the private sector providers through our social franchising program, Sabse and we provide and we ensure availability of the products through our social through chemists and retailers. Sathi is one of our flagship condom brands, which enjoys more than 80% market share. Recently, we are thankful to Dr. Talib for all his guidance, and he's the focal person appointed by Madam Minister for this program in Sindh. So thank you so much. We're really looking forward that this program will be a real underserved, and this will contribute a lot towards the FP 2030 targets. Nutrition is another area where we are working. There's a program on diarrhea management, help of Nutrition International. And recently, a product for pregnant and lactating women has been launched by the name of Velma. So in short, Green Star is working to support the overall goal and mission of the government through support of the private sector. Thank you, sir.
Thank you. The TCI, especially which is meant for urban areas, very urban. We have especially included DMPASC, both provider assisted and self-injection. And this is basically in Karachi. This program will be in Karachi and Hyderabad. So the line has been prepared and we'll be showing some of the good results. So
Thank you, sir.
FPAP, Dr. Abdul Qayyum.
Thank you, sir. First of all, thank you very much for inviting us and giving the opportunity to represent here or this auspicious gathering. I am representing here Rehnuma FPAP. We established in 1953. It is almost 70 years we are working with. We are affiliated with International Planned Parenthood Foundation, IPPF. Our operation areas are covered all across Pakistan, 4 provinces and AJK. And we are 10 family health hospital across Pakistan. In family health hospitals, we are offering intensive reproductive health package, includes family planning, infertility cases, gynecological case services, and outreach areas. We are offering services to the marginalized people, subsidized rate, when offering medical camps there to reach the hard-to-reach area. We are significantly contributing towards and we are thankful to Dr. Talib Sahab especially and CIP team for their wonderful support at every step. And we are thankful to PWD for getting contraceptives through an MOU free of cost. So we are offering these services to the needy people. We are also part of the UNFPA under the task shifting and task sharing projects. And through this project, we have taken more than 283 participants for implant insertions. 4 districts we have come. Now we are going for the next phase to provide the refresher trainings. Similarly, we significantly contributed towards Sanapress injectable service across the Pakistan.
Dr. Qayyum, and thank you for your support in overall services, but Siana Press, especially this is the NGO which is procuring Siana Press at their own and they are providing services. Basically, we are running short. Especially, I refer to Madam Shanaz Wazir Ali, who has an important meeting to attend. Remarks, but since she is leaving, so I would request her to.
It indicates that cooperative directions and creating cohesion our efforts is critical. And as I look back over the years, when we went to the London summit, and Dr. Yasmin Qazi referred to that, in 2012, it's been 10 years since then, a great deal of progress has been made. It is, I know we're looking at statistics and we wish that we were at higher numbers in CPR, especially modern methods of contraceptive behavior change and many other behaviors that we want, contraception seeking behavior, which we really want, and longer term commitments to family planning by government and all partners. Nevertheless, I think in Sindh, we have seen some very, very good leadership at the government level, with Dr. Azra Pechu being the Minister for Health and Population. That has brought a tremendous amount of functional integration as well as policy to the overall efforts in Sindh. And in fact, many people have said that how so many partners work together. It just seems a very difficult exercise to coordinate. But I think the common agenda setting that we did several years ago, and then drawing on the strengths of each and every organization here, because everybody is doing certain things that are particular to them, where they have developed their particular experience, their strength, their expertise. And congratulations, Dr. Talib, to you and to everybody else for it as one of the best practices. This is, I think, really a global recognition of the work that has been done jointly. And also particularly to appreciate the presence of the BMGF team here. And I'm really quite impressed up and down the country. Just learned from them a little while ago that they even visited Kasur, and they went to local facilities, they went to Lahore, and they've been to several places in Pakistan. So this is actually seeing what is actually happening. How does the awareness and
of CIP, and you look at the progress critically, which is very encouraging for us and learning for us every time we listen to you. So thank you so much for being here. Good to see that it's now moving very fast on public health front and engaging into public health research as well. So that's good thing. And thank you. Thank you. Forward and to also hear from. Now I invite to Riz Consulting. Add few words, but if you want to aid.
I'll make it very quick and very brief. Family planning back in 2018 by training 300 lady health workers in 2 selected districts, along with developing the supportive supervisory guidelines. And currently, in partnership with Japaigo, RIS has gone into supporting the implementation of the MPSC services. And some of the contributions have been around the standardization of the training curriculum, supporting the capacity building of lady health workers, master trainers across the province. And moreover, RIS is also focusing on this scope of work regarding policy landscape analysis across 4 provinces. This would help in understanding the policy barriers in the uptake of cyanide self-injection services. And some of the work that is left now is around the development of a resource mobilization strategy for sustainable work. So
support from the BMGF, which is through RIS and Japaigo, and we are, it's a very, very Sindh province in terms of cyanide. So AHANG is very important stakeholder working on with youth, especially and adolescents. So Sheena Hadi is country head of the AHANG. Sheena.
Is this working? Yes, it is. Thank you, Dr. Lashari. So as mentioned, yes, AHANG is working on all aspects of sexual and reproductive health with regards to adolescents and young people. At present, the main things that we're focusing on is expanding the LSB program, which we have for in school. And we're doing that through a variety of different projects that all come in together programmatically. So we do that both with own partners and with other organizations that have schools, as well as with the Sindh government as well. We've been collaborating since 2010, the curriculum content that has been printed, and we've worked with teacher training programs about building in more content and also building in the primary school level content for that as well. Along with that, we're also working on ways in which to reach out of school young people of years. So looking at comms and techs, looking at other ways that we can access, like Dr. Lachari mentioned, university services, which young people are not really accessing right now because they're usually facing a lot of discrimination and bias, become more friendly towards them. So that again, we can get back to Dr. Yasmin's point, which is that we're not just waiting until, just for that low-hanging fruit, but also work actively as well.
Thank you. It's a very important work that you are doing with young people. And the next step which we are moving is adolescents, engaging with them and their needs, not only in FP2030, but in 1000 days project, which is forthcoming, and that is RCAH. So it's are very important, and we look forward to all partners, and especially AHANG, towards engaging young people. So now we are moving to RSPN. Who is going to speak?
Assalamu alaikum. I'm Khurram Shahzad, Program Manager Operations at RSPN. In collaboration with the RSPN, supporting rural communities on ground by ensuring uninterrupted family planning products and services at the ground level. So we started collaboration with the government of Sindh in 2000 by starting a program now is called People's Poverty Reduction Program. The government of Sindh and more than 1.5 million women from the households are the organized and then making plans and then collaboration with the government at the district and the sea level. So they actually we supporting government of Sindh to working and providing family planning services in uncovered LHWs areas. So with the support of PSI and FCDO and with the support of UNFPA and AHANG, we are preparing, made very significant kind of, SBCC toolkits and material, and we provide awareness, and then our community resource person organized with the support of government of Sindh. So these are the very, you can say, great platforms, the PPRP and the accelerated action plan, which is also made for the reduction in malnutrition sin, and family planning is also a part of that. And in our each community empowerment, rural and poverty reduction program, we mainstream all the learning from these kind of platforms into the main programming. So we get Talib Saab for the overall support.
I think this People's Party Reduction Program is very important, and reducing poverty will definitely contribute towards DMPSC. So we would like to relate with your work. I'm told that we have